So today, some things dey my chest up wey me Dr. Greg Afokan talk you. Yeah, he did my chest up. So today, I'm not gonna mention anybody name. But you know, be on my class. Everybody make you can tap for the class inside. You know, some things where they go on. Someone will go to the hospital. The doctor will request for a full blood count, a kidney function test, liver function test, and all these tests. They run these tests. Most of the time, the results will be in, and the people will come home. I'll be there and someone will just text me, Doc, I went to the hospital, they gave me these medications. What do you think is wrong with me? Are you serious? You went to the hospital, you were attended to by a doctor. So you couldn't ask your doctor what is wrong with you. Most of them, the answer they will give you is that, oh, when the results came, the doctor just looked at it and he started writing the medications. So this to my colleague doctors out there, I know the work he had, but please, when these things come, I know that sometimes you get overwhelmed, but please take some minutes and explain everything to the patients, because you'll be there and someone will be DMing you with a lot of things, medications that they are on that they don't even have any idea about, and they say, which condition am I having that the doctor is giving me this medication? Then you are there and you can't even answer the question. And also, if you're a patient, you have the right to ask for your lab results. Depending on the facility that you are going to go in, it's either they will print it for you or they will send it to you either by mail or a message. It is your right. It is your own lab. It is your own blood. It is your own money. So please don't tell me that it is on their computer, I left it there. No, it is yours. So please, it is your right. Nobody will beat you if you say that, can I get a copy of my lab results? It is your own sample. It is your own lab results. It is yours. So please do so. Then to the last group of people. Now some patients, when they don't feel well, they themselves will just drive and enter into a lab somewhere, because now there are a lot of laboratories out there. They'll just go without any doctor's order. I want to run labs. Now these people will go and run these labs. Then they will come and be showing, so I went to do these labs and they say there's nothing inside. Number one, your labs wasn't authorized by either a doctor, either a nurse, either a pharmacist. You just took yourself and we just went to run the labs. Based on what? So please, let's stop this behavior in 2024. If you are sick and you go to the hospital, number one, your doctor will request a lab for you. Either your nurse will request a lab for you. Or if you go to a pharmacy, some labs are there, the pharmacist will say, okay, go and run these labs and bring me the results. When you do these things, they are supposed to explain it to you. Also, the lab results, if it's a hospital and it's being sent to their system, it is your right to know your lab results, to be explained to you to the latter, and also it is your right to request for a copy of your lab results, so that in case you are going to a different place, because in Ghana not all our health systems are intertwined. So assuming I've gone to hospital A and I'm supposed to go to hospital B, the results and the labs and even the stuff at hospital A is not automatically at hospital B. So maybe the process will have to be started all over again. Meanwhile, there are some labs that if you had a copy of them and you took them along to maybe hospital B, they can just look at it and say, okay, you've done this based on this duration. Okay, this. Then everybody is at peace. So please, just know your right as a patient. You are entitled to equitable health care, no matter your race, your gender, your sex, no matter your religion, or even your ethnicity. So please know this and know your peace. If you sit in front of your doctor, your mouth should not be shut. You should ask all your questions, and you are entitled to know whatever is wrong with you. And one thing that you should stop doing, do not walk into a lab to run labs on your own without the supervision of a doctor. By the way, after running those labs, can you interpret it yourself? Don't come and disturb me with your lab results if you know you did it yourself. This is Connect with Dr. Greg. A simple message for you. Bienvenue.